So in the first two PowerPoints and with Miss Giro's live lesson today, we learned about the anatomy and we learned about the physiology. Now we're going to learn about how the respiratory system is controlled and how everything moves within this system. So the control of respiration is controlled by two parts of the brain, and that would be the medulla and the pons. And for such a simple mechanism, it's actually quite a complex process in how we are able to conduct respiration. And the medulla is the pacemaker. It sets the rhythm so that we are able to have a normal respiration rate, which is also called the eupnea, of about 12 to 15 respirations per minute, while the pons regulates the rhythm to make sure that our respiration rate does not exceed that 12 to 15 respirations per minute. And the two muscles that are innervated in order for us to conduct respiration are the diaphragm and the external intercostal muscles, and they receive the nerve impulses to transmit them from the brain, and that transmission process is helped by the phrenic and intercostal nerves, and we'll be able to see that on the next slide. So this image shows the connection from the pons and the medulla to those sites of innervation with the phrenic and intercostal nerves. And in this little box right here, we see that the pontine respiratory centers. And remember, whenever we hear the word pons equals the pontine respiratory centers. And so the pontine respiratory centers are found within the pons, and that is indicated by this orange oval. And then that innervates all the way down into the intercostal muscles, which line the rib cage, and they also innervate the diaphragm, which just resides inferior to the lungs and thoracic cavity. And it is during this innervation and the nerves that are able to sense the increase in CO2 in order to increase our O2 concentrations within the body. So the control of respiration is conducted with these stretch receptors, and they respond to the overinflation of the lungs, which could lead to lung damage. And these stretch receptors communicate with the medulla to prevent the overinflation, and they are helped with the vagus nerves. And so the vagus nerves tell the stretch receptors to end inspiration and to initiate expiration so that the lungs do not overinflate. The vagus nerves and the stretch receptors, you can almost think of it as a form of checks and balance. both of them are needed to prevent that overinflation within the lungs. Remember, if you think back to our anatomy and physiology PowerPoints about the lungs are elastic. And if you think about the lungs as a rubber band, there is an overstretching point, and then the rubber band will snap if it becomes overstretched. Think of the stretch receptors in the vagus nerve to prevent the lungs from being overstretched. However, there may be points of our lives where we need to increase our breath and rates and our depths. And one of those times would be during times of exercise. So we breathe more vigorously and deeply because the neural centers are getting more messages or nerve impulses to increase our depth of breathing. And this is called hypernia, and that is just increasing the depth. We never increase our rate of breathing. We want that to be around 12 to 15 respirations per minute. We just change how deeply we breathe. How deeply we breathe, and we do not change the rate. So there are some non-neural factors that influence our respiration rate and depth. And to introduce, there are 4 major factors, and each of them are influenced by the outside environment. And by outside environment, the stimuli in which we are participating in. So perhaps it's a exercise, or they could also have an internal influence, such as the chemical factors. So here's just an image depicting how the brain is able to process all of these factors that influence the respiratory rate and depth. So you have the brain, which is like the processing center of all of these stimuli, and it has a voluntary control over breathing. And then you have the emotional stimuli coming through the limbic system. And all of these stimuli are processed or received within the respiratory center. And remember, the respiratory center is within the medulla and the pons. And so all of these stimuli are coming into that one small area. So starting off with physical factors, and we briefly talked about these in the non-respiratory gas movements, such as coughing, sneezing, and talking. And mainly, we address these in the fact about they prevent debris from coming into the respiratory system. However, one factor that we did not talk about is how body temperature is a physical factor, and that could be in the way of a fever or exercise. And so as our body temperature increases, we need to be able to release that extra CO2, because once our body temperature increases, we need to increase our breathing rate, which will then increase the CO2 that is built up, and it's this whole cascading effect on how body temperature affects our breathing rate as a physical factor. So volition, or also called conscious control, is limited in the fact that the respiratory centers will ignore messages being sent from the cortex. So you have tried to hold your breath underwater, or maybe when you were a kid you had competitions on who could hold their breath for the longest. And our wishes come from the cortex part of the brain. And when our cortex are sending these messages to our medulla and the pons and the medulla have this special power that they're able to ignore our wishes so that breathing can be continued. Because if we are not breathing, there are a whole host of problems that originate from that, such as our cells are not able to receive the oxygen they need to survive. Secondly, when the oxygen levels are really low and our blood pH is falling because we are holding our breath, the brain again ignores those voluntary signals, which deems the respiratory system as an overall involuntary system. We don't have to think and tell our brain to breathe for us. It already does it for us. Next, we have emotional factors, and these are the emotions you experience that influence the rate of breathing. So perhaps you are watching a scary movie and you gasp when you see the monster or the murderer pop out of nowhere. You are taking an extra inhalation of air that you normally wouldn't use in your normal respiration rate. Or when a person watches a horror movie and they're panting in fright because they're scared. All of these emotions impact the rate at which we breathe. And finally, we have the chemical factors that impact the rate of respiration. And the chemical factors are actually the most important. And they are the most important because they are responsible for adapting to change within our body. We are not able to see the processes that are carried within our body, and so we have to rely on these chemical factors to make sure that we maintain homeostasis. And one of the biggest chemical factors is the increase or decrease of blood pH. Because when we are decreasing the blood pH, so that means our blood is becoming more acidic, it has this direct impact on the medulla centers and how they're able to function. And so when we have increased levels of CO2, we have an acidic environment in which is not great for our body. Remember, we always want our blood to be around 7.2 to like 7.4. Anything above that is considered an acidic environment, and things can denature and not function properly. However, when it comes time for really low oxygen levels to be detected in our body, that is going to come from the aortic arch. When that happens, the aortic arch is able to increase the amount of oxygen that is pumped out throughout the body. and is just going to almost go into overdrive to make sure that oxygen is being delivered to all the cells in our body. However, there is a fine line between having enough oxygen and getting too much oxygen. And you might be familiar with a term called hyperventilation. Which is the increase in oxygen levels, and there's too much oxygen, so you need to replenish some of that CO2. And you can do that by having the individual who is hyperventilating breathing into a paper bag so it captures what little CO2 they are putting out and be able to recapture that. So next we're going to get into the problems of the respiratory system by looking at 4 common respiratory disorders. So the first disorder that we will be talking about is COPD, also known as the chronic obstructive pulmonary disease. And it's the major cause of death and disability in the United States. And you typically are not born with COPD. There are a whole host of environmental or behavioral choices that create an individual to have COPD. And those environmental or behavioral choices can be found listed right here, with some of them being smoking, dyspnea, or which is intense labored breathing, and they have a hard time bringing air into their body via their conducting passageways. A couple of symptoms could be intense coughing or hypoxia and chronic pulmonary infections. And COPD will ultimately lead to respiratory failure, and that the individual has been living with these obstructed passageways or decreased function, and that will lead to respiratory failure. And under COPD is almost like an umbrella term. It's all encompassing of different types of disorders, and there can be many categories and subcategories of COPD. Next up, we have chronic bronchitis, which is when the mucosa of the lower respiratory passages, so you're thinking your lungs and specifically your bronchi and bronchioles, become inflamed, and they produce and almost overproduce mucus. And the pooled mucus does not allow for efficient gas exchanges. And when there is too much mucus found within the lungs, you are more at risk for pneumonia, which is the presence of fluid within the lungs. And again, we have several mechanisms and features of the respiratory systems that prevent the buildup of fluid and debris within the lungs. And typically, patients are called blue bloaters due to the hypoxia, which, if you recall from the first PowerPoint, is the lack of O2. And typically, to be deemed hypoxic, your oxygen saturation has to be less than 75%. Next, we have emphysema, and that is when the alveoli are too big for the walls of the adjacent chamber. And so when things get too large, they become inflamed, which promotes the fibrosis of the lungs. So the lungs are not able to recoil as much as they would, which would then lead to the collapse, especially during expiration. And the patients have to forcibly exhale, and which leads to exhaustion because it takes a large amount of energy. To forcibly exhale. And if you remember to our first PowerPoint, we have our ERV, which is the expiratory reserve volume, and is typically a patient who has emphysema is going to utilize their ERV instead of their tidal volume. And the patients are often referred to as pink puffers because of the inflammation in their lungs, and patients tend to be barrel-chested. Next, we have lung cancer, and again, much like COPD, lung cancer is almost like an umbrella term. There are many types of lung cancer, and lung cancer is one of the cancers that's probably the most aggressive and most metastatic, or ability to spread rapidly and widely. It can be hard to diagnose, and typically lung cancer has a low survival rate, and lung cancer can be as a result of other cancers. So the average person lives about 9 months after the diagnosis due to its late-stage diagnosis. And we will explore the 3 different common types of lung cancer, which are squamous cell carcinoma, adenocarcinoma, and small cell carcinoma. So squamous cell carcinoma makes for a small percentage of lung cancer cases, about 25 to 30%, and it's typically found within the epithelium of the large bronchi. Remember, the large bronchi is the first branch that protrudes into the lung, and they form masses that hollow out the bleeding. And the bleeding is due to the exposed vessels within the bronchi that cause that bleeding. And so if you have extra fluid within the bronchi, you first suffer from loss of blood, but then you also have fluid that shouldn't be in there, and you have a greater chances of pneumonia and other respiratory infections. Next, we have adenocarcinoma, which makes for the large number of lung cancer patients, about 40%. And it originates in the peripheral areas of the lung, so you're going to think of like the body or the lobe area of the lungs. And then solitary nodules, or if you want to think of lumps, will develop from the bronchial mucus glands, which will then descend into the alveolar cells. Next up, we have small cell carcinoma. Only documented 15% of cases. However, there is an increasing rate of small cell carcinoma within your lungs. And it contains about like a lymphocyte-like cells. And much like the other lung cancers, it originates in the main bronchi, but they grow aggressively in small clusters that will lead into the mediastinum. So next we are going to move into the developmental aspects of the respiratory system, and we're going to talk about 4 different age groups: birth, youth, middle age, and old age. And this was taken by past students. So in infants, the lungs filled with fluids and all respiratory exchanges are made via the placenta in the fetus. And so, if you remember from today's lesson with Miss Jiro, we talked about this fluid called surfactant. And the surfactant is developed at about 37 weeks gestation. And so the passages when the baby is in utero are filled with these respiratory fluids, and once they are born, the passageways are filled with air when the baby starts to take its first breath. So that is why when the baby is first born, they use a tool to suction out the fluid so that the baby is able to take its first breath. Now, infants have a higher respiration rate at about 40 to 80 respirations per minute, but as the baby grows and develops, it will lower to about 30 respirations per minute. So in youth, we're typically talking about adolescents, anywhere from 10 to 17 years old, depending on what developmental expert you ask, or actually about 5 to 25. There's a big bridge. So I consider 10 to 17 adolescent, which is you. So the lungs continue to mature throughout childhood, and interesting fact that the alveoli continue to grow with us. So as we grow, more alveoli develop. And we need that as it increases efficiency. So increases efficiency. And then young teens who smoke, they have a decreased amount of alveoli. And you are never able to regain those lost alveoli. So some might die and others just won't grow. So that is why smoking should be a no. Middle age, so perhaps around 30 to 55 years old. You have reached your maximum capacity of alveoli, and how many you have when you enter this stage is how much you will have for the rest of your life. Your respirations decrease just a little bit because as we age, we are reaching almost a carrying capacity or a plateau effect, and things start to become a little more rigid. The lungs will lose their elasticity or their ability to recoil as much, and everything just comes a little bit more firmer as we enter old age. So when we enter old age, everything is going to decrease significantly, almost by 1/3 by the time you reach 70 years old. Your blood oxygen level will decrease, and you start having sensitivities to things that you typically wouldn't have when you were younger. And you have more chances of becoming hypoxic, such as having sleep apnea or the risk for respiratory tract infections, as your respiratory tract is unable to clear the debris that you typically could. So your cilia might be impacted. Remember, as we age, our ability to function decreases significantly. And lastly, I just want to talk about probably one of the most prominent respiratory disorders is asthma. And asthma is just always having these inflamed bronchial passages. So if you see here in this image, a normal bronchial tube is pretty much a straight shot right into the lung. There's no obstruction. You don't have any irritants building up. However, in an asthmatic patient, the diameter of the bronchiole is significantly decreased by all of this scarring and tissuing and debris. So think about your bronchioles as a highway. And in an asthmatic, the highway is severely congested with traffic. Whereas highway over here is much like the highways we have in upstate New York. There's lots of room and there isn't that much congestion. So that wraps up our PowerPoints for the respiratory system. If you have any questions, feel free to reach out.